Hello, and welcome to this Dr. Meek Anesthesiology Explainer. Today, we're going to do a focused clinical review of a drug that's a cornerstone of our practice, glycopyrrolate. Before we proceed, just the necessary disclaimer. This content is designed for educational purposes for medical professionals. It, of course, does not constitute medical advice, and you should always consult official guidelines for clinical practice. The source for this review is Wiki Anesthesia.
Here's how we'll structure our discussion today. We'll begin with a core overview, then move into its primary clinical applications, followed by its pharmacodynamics. After that, we'll cover adverse effects and precautions, and we'll wrap up with a summary for clinical practice.
All right, let's get started with Section 1, a core overview of glycopyrrolate.
So what is it, fundamentally? Glycopyrrolate is an anticholinergic drug, and it's a real workhorse in anesthesia for some very specific and predictable reasons.
Now, this is the single most important thing to remember about glycopyrrolate, the feature that truly sets it apart. It does not cross the blood-brain barrier. And why is that so critical for us? It means we get the peripheral effects we're looking for without the central nervous system side effects like sedation or delirium that you might see with other anticholinergics like atropine.
Okay, so keeping that unique property in mind, let's look at its primary clinical applications. When and why are we actually reaching for this drug?
Well, its most immediate use is managing bradycardia. It's especially valuable for treating the kind of reflex bradycardia that can be triggered by vasovagal reactions during surgery. In those moments, its prompt action can be absolutely critical.
Its second major application is as an anti-salagogo. It is highly effective at reducing salivary, tracheobronchial, and pharyngeal secretions. This is invaluable for maintaining a clear airway, particularly during procedures where that's a concern, or when you're planning a fiber optic intubation. And here's another crucial role, its synergy with neostigmine during neuromuscular blockade reversal. When we give neostigmine, we know it's going to cause some significant muscarinic side effects, most notably bradycardia. By co-administering glycopyrrolate, we can selectively block those unwanted peripheral effects without introducing any central nervous system impact. It truly is the ideal partner for neostigmine.
So how does glycopyrrolate actually achieve all this? Let's take a quick look at its essential pharmacodynamics to understand the mechanism of action.
You are listening to the Dr. Meck series.
The mechanism is very precise. Glycopyrrolate functions as a competitive antagonist of acetylcholine, but specifically at those peripheral muscarinic receptors. It physically blocks acetylcholine from binding, which in turn inhibits the downstream parasympathetic nerve impulses. Of course, with any drug we administer, understanding the risk profile is paramount. So let's now cover the known adverse effects and necessary precautions.
The adverse effects are a direct extension of its anticholinergic mechanism, so they're quite predictable. We should anticipate and monitor for tachycardia, a very dry mouth, some blurred vision, and also the potential for urinary retention.
Now, it's important to point out that our source material, Wiki Anesthesia, does not list any absolute contraindications for using glycopyrrolate. That said, sound clinical judgment and caution in specific patient populations are, as always, warranted.
To finish up, let's distill all this information into a concise summary of the key takeaways for your day-to-day clinical practice.
You are listening to the Dr. Meck series.
Think of this as your mental checklist. Glycopyrrolate is your peripheral anticholinergic for bradycardia and secretions. Its cardinal feature is the lack of central effects. It's an indispensable part of neostigmine reversal. And finally, always monitor for those predictable peripheral anticholinergic side effects.
And I'll leave you with a question to consider in your practice. In which critical patient populations might glycopyrrolate's lack of central effects be the most advantageous? Think about this in the context of elderly patients or perhaps those with pre-existing cognitive deficits.